If you've ever seen an ultrasound of a fetus in an expectant mother's belly, then guess what? You're already familiar with the basics of a CIMT. The difference is, instead of pointing an ultrasonic sensor with a wide beam at the womb, we use an ultrasonic sensor with a narrower beam and aim it at the left carotid artery and the right carotid artery. The carotid arteries are the main supply lines that get blood from the heart to the head. Using the CIMT technology, you can see inside the arteries. And how cool is this? You can actually see the individual layers of the arterial walls. Plaque builds up between the intima and the media layers of the artery, hence the name, carotid intima media thickness test. We're literally measuring the thickness of the plaque by measuring the distance between the layers of the artery wall. We can also see the plaque type, hard or soft, which is important because it's the soft plaque that ruptures out into the bloodstream and causes the clots that cause heart attacks and strokes. Hard plaque is like an old scar that's stable. Soft plaque is like a fresh wound that's full of pus and that easily ruptures at the slightest provocation. And when that soft plaque ruptures out into the bloodstream, it coagulates and causes a clot. Using the CIMT, you can even see where the carotid artery splits into the internal and external carotid arteries. The internal carotid artery goes internal to the skull, to the brain. The external carotid artery goes external to the skull, mostly to feed the face. Now that's important because it's the diverging blood flow that causes extra turbulence and extra pressure on the arterial walls, so it's the perfect place to look for arterial damage and plaque. The CIMT shows you all of that, and it's quick, easy, safe, and inexpensive. If you want to learn more about CIMTs, check out the CIMT playlist in the description below, where I document my CIMT journey. You'll see what the technician actually sees on the screen in real time in the live demo videos. The results videos show you how my arterial health has progressed over time from multiple CIMT providers, so you can see what kinds of reports and data to expect. There's videos comparing CIMT companies to help you understand what to look for when choosing your own CIMT provider. And there are videos comparing CIMTs to other diagnostic tools like the calcium score, or the flow studies, or coronary CT angiograms to help you understand where CIMTs fit in the hierarchy of arterial testing. There's a few recurring themes you'll find in all of these videos. Plaque isn't a heart attack thing, and it's not a stroke in the brain thing. It's a systemic, whole-body, metabolic thing. That is, if you have plaque in one place, you probably have plaque everywhere. So why not start looking in the least invasive, quickest, easiest, and safest place you can, the carotid arteries. If you see some plaque there, then yeah, you need to think about using some of the more advanced and more invasive and less safe diagnostics to check your heart. It's the soft plaque that kills you, so you need to be using a technology that looks for soft plaque. For example, the popular calcium score test only shows you hard plaque, which is a start, but it doesn't give you the whole picture because it doesn't show you the unstable soft plaque. It's important to find a reputable CIMT provider that has a rigid protocol for doing CIMTs. That way, you know you're getting good repeatable results. Unfortunately, CIMTs are not a point-and-click type of thing. They require a fair amount of experience, skill, and training to get good, reliable, and repeatable results. So finding a good provider is essential. And finally, there's a right way and a wrong way to go about diagnosing your arterial health to get the most benefit with the least amount of risk and cost. And unfortunately, in my opinion, most doctors do it wrong. Check out that CIMT playlist to learn more about this amazing, inexpensive, safe, quick, and easy procedure. You'll be glad you did.